Can we get a move on, Q-Tip? I got tickets to bring in the noise, bring in the funk, and I don't want to miss the noise.
That means Nurse Roberts is going to take a blood sample so we can check your hepatitis viral load. Absolutely no big deal.
Okay, it's just going to be a little steam. In a minute. Okay. Here we go. Okay?
Somebody get that?
These tests are going to come back negative. Believe me, everyone in the hospital gets stuck.
Thanks for being so nice to me.
Well, who would it be?
Hello, Dr. Dorian. Understand you might need a refresher course in hospital safety. This is a syringe, and when filled with infected blood, where's the last place you might want to stick it?
In my arm.
That is correct, Dr. Dorian.
Oh, Mr. Sarcastic strikes again. Please, God, just fire me.
Just get him to sign the paper.
Here you go.
What is this?
If you should develop any symptoms such as fatigue, abdominal pain, dark urine, joint pain, loss of appetite, nausea, vomiting, yellow of your skin, the whites of your eyes, that suggests you might have hepatitis, it's just, says the hospital is not responsible. Also be aware that you could have a risk for hepatitis B and D and blah, blah, blah. Just sign the paper.
Oh, that's comforting.
Here, have my pen. I'm sure you'll be fine. Sure you'll be fine.
I don't have to use your pen.
Yeah, just keep it.
All right.
I'd like to say something that I've prepared tonight.
All right, Alan.
Hello. How about that right in? I guess that's why they call it Sin City. Ha 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 ha. You guys might not know this, but I consider myself a bit of a loner. I tend to think of myself as a one-man wolf pack. But when my sister brought Doug home, I knew he was one of my own. And my wolf pack, it grew by one. So there were two of us in the pack. I was alone first in the pack, then Doug joined in later. And 6 months ago, when Doug introduced me to you guys, I thought, wait a second, could it be? And now I know for sure. I just added 2 more guys to my wolf pack.
All right.
4 of us wolves running around the desert together in Las Vegas, looking for strippers and cocaine. So tonight, I make a toast.
Alan.
Blood brothers.
No, give me the knife. Give me the knife, Alan. We are not going to cut ourselves.
What are you thinking, man? You can get hepatitis G that way.
Don't you mean hepatitis C?
I don't think there is a hepatitis G.
Yes, there is. Hepatitis G, you can get it when you got hepatitis B or C or HIV.
What's hepatitis?
Well, Alan, it's diffuse inflammation of the liver, commonly a consequence of a viral infection that can be secondary to fungal or bacterial or parasitic infections, a result of toxic exposure, a side effect of a prescribed medication, or a consequence of immunological disorder. There can be acute or chronic hepatitis.
Acute lasts less than 6 months. It can either resolve itself to normal liver function or progress to chronic hepatitis, then cirrhosis and possible liver
How do y'all
failure.
know all this?
Well, Alan, I went out with this hot nurse one time in college. Her name was Karen? No, Mandy? No, that's not right
You
either.
can get hepatitis from blood.
Yeah, you can. I mean, you can get it from blood and sex. Alright.
How would I know if I had it?
I mean, it's mostly asymptomatic.
Oh God, I could have hepatitis.
No, Alan. You're not in the
that's what I
high-risk
said.
group. It is mostly from transfusion and organ transplant recipients, IV drug users,
Gallon.
hemodialysis patients, and homosexual men.
Gallon.
So, you're saying I'm a IV drug user?
No, Alan. Just forget it.
Okay.
Lieutenant Dan, what are you doing here?
Well, I thought I'd try out my sea legs.
But you ain't got no legs, Lieutenant Dan.
I know that. You wrote me a letter, you idiot. Well, Captain Forrest Gump, I thought I'd see this for myself. And if you ever said you were going to be a shrimp boat captain, I'd be your first mate. Well, here I am. I'm a man of my word.
Okay.
But don't you be thinking I'm going to be eating any raw shellfish. The last thing I need is Hep A or E. You can get that from them swimming in contaminated water with sewage. Back in Nam, the idiot cook forgot to wash his hands after he went to the can.
What?
The whole unit got Hep A. They had anorexia, fever, nausea, vomiting. They had fatigue, dark urine. I followed one guy out of the tent and saw him going to the bathroom outside, and he had clay-colored stools. God. Whew, damn oral fecal transmission. But don't you be thinking I'm going to be calling you sir either.
No, sir.
Hello, Jack. I've changed my mind. They said you might be up here.
Take my hand. Step up and close your eyes. Hold on. Do you trust me?
I trust you.
Don't be.
I'm not.
Open your eyes.
I'm flying, Jack. Wait, do you have hepatitis C? Because 70 to 80% of people are asymptomatic, but symptoms could be anorexia, fatigue, fever, right upper quadrant pain, dark urine, clay-colored stools, and transmission is through blood products, transmitted tissues, and sexually, and we might have sex later in a car.
The most commonly transmitted hepatitis C is through IV drug use. You cannot get hepatitis B is transmitted with hepatitis D. So if you have hepatitis B, you will also have hepatitis D. But they won't figure that out for another 77 years.
Pig.
Come on, man. All right, quit messing around. Give it a shot. All right. Well, I'm getting this ready under your shirt and behind your heart. Has it got to be exact? Yeah, it's got to be exact. You're giving her a shot through the heart, so I guess it's got to be pretty exact, man. And I don't know exactly where the heart is, but I think it's right here.
That's it. You better hope she ain't got Hep B, because the mode of transmission is through direct contact with blood and blood products, and there's a lot of blood.
She ain't got Hep B.
You didn't do her, did you? Because you can get Hep B through sex or contact with contaminated objects. God, I hope she ain't knocked up. If she got infected in the third trimester, the baby has it.
What are you talking about? Are you a doctor?
I'm just saying, she's in a high-risk group. IV drug user, multiple sex partners.
Just shut up and get me a black magic marker.
A what?
A black magic marker. A
Oh,
felt pen. A black magic marker. Come on, man, hurry up.
Okay, I think it's ready.
Hurry up.
Yeah, it's ready.
No, man, I ain't giving her the shot.
No, I ain't giving her the shot.
No, you're giving her the shot.
No, man, you're giving her the shot.
I ain't never done this before.
I ain't never done this before either, and I ain't starting now. Look, you brought her here, you give her the shot. The next time I bring an OD girl to your house, I'll give her the shot. But here you go.
Give me that.
Here.
All right, tell me what to do.
Okay, look. So you're giving her a shot of adrenaline through the heart. There's breastplate here, so you gotta pierce through that. So you gotta have a stabbing motion.
What, I gotta stab her 3 times?
No, you just stab her once, but it's gotta be strong enough to get through that.
And then what happens?
Well, kind of curious about that myself.
This ain't no joke, man. Am I gonna kill her or what?
No, she's supposed to come out of it like that.
All right. Count to 3.
Okay, you ready?
2, 3.
If you're all right, say something.
Something.
Is it too late now to say sorry? 'Cause I'm missing more than just your body.